Hi guys, so we're back and today I have a guest with me and we're wearing pink, obviously because it's Breast Cancer Awareness Month. So I thought we could do an interesting video. So my guest here, he's a doctor.
Good afternoon. Hi, my name is Dr. Elda. Jade and I are friends, so she calls me by my first name, which is Rion. And today we are going to go through a self-breast examination since it is Breast Cancer Awareness Month. And 8 out of 10 women discover their lumps on their own at home and then bring it to their doctor's attention. I think it's important to know how to examine yourself, so we're gonna go through that today.
And I thought it would be nice to do it on video because I've googled before, obviously, how to do a breast examination, but when you're reading it versus seeing someone how to position your arm or where to touch or where to feel for and describe what exactly you're searching for, I think is a bit different. So before we get into the breast examination, we're just going to talk a little bit about some of the myths or things that people should know when it comes to breast cancer awareness. So I know when I was younger, I thought only women who were, voluptuous. I thought they were more prone than maybe somebody like me who is a little A, a little B cup now. But apparently that's not the case. Anybody could get it, no matter.
Anybody can get it, including men.
Which is another one as well.
So anybody can get it. I think about 1% of cases happen in men, but it does happen.
So it's not just for women, Breast Cancer Awareness Month. Yes, it's more prominent in females, but for men, it can happen to you, and also you should know what to look for. If your partner is a female, obviously, you may feel something that she may not.
Yeah, and interestingly enough, I've had a couple of patients who said, well, doc, it's not me that found it, it's my boyfriend. I found it, well, when he was touching it. So that happened.
So it happened.
Yeah.
So this video is for everybody. Everybody needs to know. Everybody should stay informed. When would you advise that females start examining? Like at what age?
I think once you start developing breasts, it's important to start to examine them, because when you know what your normal is, it's easier for you to detect changes. I'd recommend that you examine them 3 to 5 days after your period, because that's the time when, at least in most women, when your breasts are the least tender and the least swollen. If you're postmenopausal, then just choose a particular day of the month that you can stick to.
Yeah, and do it every day.
So if it's the 11th, then you do the 11th every month. So you know, okay, it's the 11th today, I examine my breast.
Yeah. You could only do a breast, like a mammogram, in a private thing?
No, you can get a mammogram done in a public health facility, but normally what happens is that you'd have to get the... somebody have to give you the card, the referral from your health center. So yeah, if it is at your health center doctor thinks that is necessary, then they'll give you the card to get it done. But there's more women who are like prone or come from families where like they have the gene or you have a family history, then they recommend I think from about, if you have a family history, then about from 10 years before the age of the youngest relative. If not,
what do you mean by that?
Right, so if it is you have like a family member who died with breast cancer, or if it is you have the BRCA gene and that kind of stuff, then normally you're supposed to get your mammogram done, I want to say yearly or every 2 years. I think it's yearly if you have the BRCA gene.
Where's the BRCA gene? I never heard
That's the BRCA1 and 2. Those are the genes for...
that make you prone
to breast cancer. Yeah.
Was like a test or something?
It's a test. I don't think it's available public. It isn't available publicly here. I don't know if it's available privately here. Some settings, there are women who, if you test for it, you can opt to have bilateral mastectomy before, and that's what Angelina Jolie did. Yeah.
So she have the gene and she just decided,
let's just take the breast out, let's just skip it, and yeah.
Seriously?
That's an option too.
Okay. That's a little extreme for me, but I guess if you just want to
preempt it,
yeah.
Then live your life in fear all the time. So there are people who do that. Or the other option is just to be super ultra mega vigilant, get your mammogram and your breast ultrasound.
Okay.
Yeah.
So if you want to have a mammogram done, I'll leave some links in the description where you could go private centers that do it. And I would say if you are probably over 35 or something,
Ooh,
that's too old?
No, it's not. To get it done regularly.
Yeah.
Right, so younger women have denser breasts. Younger women have denser breasts, right? So you can pick up, it's easier to pick up the lumps on an ultrasound in younger women and easier to pick it up on a mammogram. In older women, they more recommend women 55 years and older get their mammogram done every 2 years.
Okay, so now we're going to move into the self-examination, and Dr. Elder is just going to guide me on where I should look, what I should be looking for. So what's the first thing you want to do?
You want to look and then feel.
Okay.
So you would begin in front of the mirror, naked. You are looking at your breast. You're looking for changes in the breast size. Looking for changes in the breast shape. Looking for changes in appearances such as darkening, puckering, visible lumps. You're looking for any kind of flaking or crusting around the nipple. You're looking for any unelicited nipple discharge versus one that you'll elicit later, which we'll get to. Okay. You're looking for what they call peau d'orange, which is your breast could look like orange peel skin, where because it's swollen, you see like the indentations of your pores, and that looks like an orange peel. Right. Yeah. And then there's also the bra sign, where if your breasts have changed in size due to swelling, you realize that your bra, which used to fit you well, would mark you on your breast. So those are things to look for. Okay. Still in the looking stage now, you want to put the hands over the head, which would help the two of them. So any puckering that might happen below the nipple then might show. Okay. And then you want to put your hands into your waist. Hands on your waist and press into your waist, which is going to help your pectoral muscles to contract so that if any masses are attached to the muscle, they will become more prominent. And those are the things that you would look for in the looking phase. And all the changes that you look for in the breast, you also keep an eye out for those things in the armpit. Because people don't realize that their breast extends and some people. But your axilla, which is what the medical term for your armpit, is an extension of the breast, as well as when you do have breast cancer, the axillary lymph nodes, which are the lymph nodes in your armpits, are the first lymph nodes that cancer would metastasize to. Oh. So, well, to get inflamed, well, as in it might show as a visible lump in the armpit as well, or swelling, or or skin color changes in the armpit. So you want to look out for that as well. Yeah. Okay. So that's the looking phase. So
all those are the visual signs of what to pay attention to.
You also want to look out for nipple changes, as in sometimes your nipple becomes inverted. So everybody's nipples are supposed to be everted, but they can invert if they're like tethered to the mass. So you want to look out for.
If your nip's not pointing at the mirror, then we have a problem.
Yes. Okay. Yeah, so that's another thing to look out for.
Okay. So those are all the visible signs you need to look out for. We'll have a list of them in the description bar below. And now we're gonna get into the physical signs to pay attention to.
So since you would already be standing in front of the mirror, you can start off standing and then you can do it lying as well. There are different patterns that you can use when it comes to examining the breast. I guess you can do whichever one you're most comfortable with, or you can do all three. Okay. So you're using your middle, ring, and index finger.
Index is what finger? Pointer finger?
Pointer finger. Okay, right. And you're using the pads of those fingers, and you're in each motion, in each place that you touch, you press firmly but gently, because you're trying to harm yourself, and you just make you put some pressure and you make a little circle there as you palpate that area, right? So what you can either touch as you touch. So you could either, if this is your breast, you can either do a spiral pattern coming out from the nipple. Now I'm going a lot faster than you're supposed to, right? So you're supposed to touch and feel, touch and feel, touch and feel, going from to make sure you don't miss anywhere, going from the nipple straight out in a spiral. You can also do it like spokes on a wheel. So again, using your nipple as the focal point, going up this way, and then out this way, and then out this way, and then out this way. I like the spiral because I feel like you won't miss anywhere with the spiral, because sometimes if you do the spokes, like if it's between two spokes, you might miss it, if that makes sense to you. And another way you can do it is going up and down from either the outer aspect or the inner aspect. So let's say this is your breast and this is in the middle of your chest. You go down and then up and then down and then up and then down and then up. Again, trying your best not to miss anywhere. And again, when you're finished, not forgetting to feel inside the armpit. You also want to gently squeeze the nipple to see if you have a discharge. The discharge could be clear, it could be yellow, it could be red, it could be a bit brown tinged. Some people have even had green discharges. It could be, those are all the colors. It can be milky. That was what was missing. It can be white and milky.
This obviously, like if you're
breastfeeding, then it would likely be milk. But barring breastfeeding, women who aren't breastfeeding don't usually have nipple discharges. If it is you do have a nipple discharge, that's an abnormal finding.
Since we're on the topic of breastfeeding, what about like pregnant or breastfeeding women? I know your body changes during those times.
Right.
How to then, because to me, if you self-examine, I know some breastfeeding women talk about sometimes the I don't know, portals could get clogged and you might feel something hard. The ducts, right? How somebody who is breastfeeding would differentiate if it's that versus something else?
Again, if you are examining your breasts monthly, and if you've been examining your breasts monthly from before, you know what your normal breast feels like. So you would know you would be able to detect an abnormality because you know what your breast is supposed to feel like. But if you are breastfeeding and you do feel a lump or you do feel a change, I would say, well, breastfeeding or not, to go to your doctor immediately. And if it's a clogged duct between you and your doctor and taking your history and doing your relevant exams, you can figure out whether or not it is. But breastfeeding or pregnancy does not make you immune to breast cancer. So I think you should still do your examinations while breastfeeding, while pregnant. And if you do feel an abnormality, to still bring it up. The one thing I will say in some of the things that happen to women who are breastfeeding, like for example, a mastitis, which is like an inflammation of the breast, those conditions tend to be painful. In most instances, not all, but the majority, breast cancer is a painless lump. So when you finish with the standing examination, the next thing you would want to do is your lying examination.
So you have to do the both of them, or is it either or?
I would say do both, just to be safe, because depending on the size of your breast, you may be better able to access the lower parts of it lying versus standing.
If it's like the fold, like
it might be harder for you to feel lumps in that lower area.
So what exactly, when you're feeling around like that, what exactly you're feeling for? What's the difference between maybe just muscle to what exactly does it feel like a marble? Like,
well, again, you would know what muscle feels like after you've been doing it for a while. And there are women who naturally have like nodular breasts, that those would be smoother, this would be like a bit more mobile. There are women who have fibroadenomas, which are not breast cancer, but they're fibrous breast lumps in the breast. They tend to be painful around your period. They tend to be a lot more mobile. They're known in some fields as a breast mouse. Cancers tend to be firmer and immobile, but there's a phrase that they always teach us that diseases don't read textbooks. So just granted that's what it normally looks like or normally feels like, that doesn't mean that that's what yours is going to show up as. What you're feeling for more likely is a firm, non-tender, immobile mass in the breast. But if you do have a mobile mass, if you do have a smooth mass, if you do have a painful mass that wasn't there before, still seek medical attention. Might it be breast cancer? Not necessarily, but it's better to know, to investigate, to find out that it isn't, than to not, and then find out that it is.
So that's it for today. I hope you learned a lot about how to self-examine both physically and visually, what to look for, common misconceptions. I'll do my best to leave all these steps down below, also some resources to where you could get tested, your mammograms done, and just to read up on more information. Thank you so much, Dr. Eldra,
no problem, Jade.
For being here. If you have any questions with him, leave it in the comments, and I'll tag him, and then he'll respond, and then you could talk.
Sure.
Okay, thanks for watching, guys. If you're liking the content, please like and subscribe, and stay tuned for more. I try to switch it up, do things new, educational, all those things.
Yeah. Good.
Okay, bye, guys.
Bye.